Hi, I'm Emily. I'm going to be doing the subcutaneous insulin for James Lonnie, and I will walk you through the steps. So I have my MAR that has all of its information. I'm going to knock on his door, knock back. Hi, I'm Emily. I'm going to be your student nurse. Can I just have your full name and birthday, please? He's going to say his name is James Lonnie, and his birthday is February 17th, 1946. I'm also going to verify it on his bracelet. It says that, and I'm also going to ask him if he has any allergies, any medications, and he's going to say that he is allergic to codeine, and then I'm going to just double check it on the MAR. It does say he's allergic to codeine, and we will not be administering that today, so he is all set. I'm also going to check to see if he has any contraindications to giving him his subcutaneous insulin shot on his lower abdomen. There are no rashes or skin lesions or ulcers, so he is all set to give subcutaneous insulin in his lower abdomen. I've also looked outside, and his breakfast is all outside, so he's all set to get both of the insulin shots. And I checked his pertinent lab paperwork, and the blood glucose level was 140, so I'm going to be giving him his regular insulin as well. And so I'm going to go and prepare that, and I will be right back. So I'm going to go to the Pyxis and grab my medication. I'm also going to check the MAR against the physician's note to make sure that the medication is both accurately put on both ones, and it is. So I'm going to take my medication from the Pyxis. They're clean. They both have caps on them. I'm going to look at the expiration date. All right, 2027 on both of them, so these are still usable. And I'm also going to check the medication against the MAR, which is the first check for accuracy, NPH insulin and regular insulin. Yep. So I'm going to go and calculate my dose. I need 30 units of the NPH insulin. I'm also going to kind of roll in my hands to make sure that it is cloudy and not clear. So I need 30 units of the NPH insulin, and since his blood glucose was 140, I'm going to have to give him 4 units of the regular insulin coverage, which is a clear vial. And so I'm going to get my needle, and it is the 28 gauge, a 1/2 inch needle, and it's sterile. I'm going to open it very carefully to make sure that I can leave it in the boat. I'm going to take it, and so in my syringe I will have 34 units. So I'm going to put the needle right down there, and I'm going to do some aseptic technique on my vials. I'm going to take a clean wipe, take the cap off, and do it for 15 seconds. And then I'm going to do the same thing with the other one for 15 seconds. That over there. And I'm going to grab my needle. I'm going to uncap it, making sure to maintain sterility throughout the whole entire time. Put it back in the boat. I'm going to draw up the 30 units of the NPH insulin first. So I'm going to put 30 units of the air, maintaining needle sterility to make sure it doesn't touch the sides or the liquid. So I'm going to put the 30 units of air in that one. And then I'm going to draw up the 4 units of the regular insulin. Doing the same procedure, making sure needle sterility the whole entire time. And I'm going to flip it over and pull down for 4 units. And then I will do the same thing with the NPH for 30 units. So the syringe will have 34 units altogether. Making sure to maintain needle sterility the whole entire time. So there's 34 units. I'm going to safely cap the needle back on, making sure to maintain needle sterility. I'm going to just put that in the boat. I'm going to label my medication syringe with the patient's name, James Lonnie. The drug is NPH and regular insulin. Amount is 34 units. prepared date is 10/8 and the time is 7:25 because I'm going to be giving it for his 7:30 meds, but the current time is 7:25. So I'm going to be giving it right at 7:30. Prepared by Emily, EHSN, and expired. So I'm going to go and put this on the syringe. And then I'm also going to label my vials. So I put the patient's name, James Lonnie, room number is J. So I'm going to put that on the vial. Make sure to not block anything. And I'm going to do the same thing for the NPH, James Lonnie, room J. Making sure not to block anything. All right. I'm also going to do the second check to make sure that I have the correct medication in after the calculated dose. And so that is right. Third check for accuracy. So now I'm going to go into the patient's room. So I'm just going to bring the needle, the medication, my sterile gloves, all that. Knock, knock, knock. Hi again, I'm just gonna be doing your insulin shot. Can I have your full name and birthday, please? James Lonnie, February 17th, 1946. And then I'm gonna also do the third and final check for accuracy against the MAR and the medication, and page insulin, regular insulin. Yep, so that is accurate. And then I'm also just gonna do some patient education. You're getting your insulin shot today to help lower your blood glucose level so that when you eat, it doesn't spike up. So your breakfast, I see someone brought it in for you, so we're just gonna get ready to give you your shot. I'm gonna provide privacy and make sure that the patient is comfortable. I might lower him down. And then I'm going to go and put my sterile gloves on. And I've been doing the 6 rights of medical administration. I check that I have the right patient, that I have the right dose, that I have the right medication, the right route, and the right time. And then I will do the right documentation after I administer the medication. So I'm gonna go and grab my alcohol wipe, and I'm gonna locate the injection site. I'm gonna pull it down, making sure there's privacy and he's comfort. It's 2 inches from the umbilicus. I'm gonna start from the middle and go out for 15 seconds. All right, I'm gonna make sure it dries. I'm gonna go and grab my needle and my gauze, making sure it's dry. And I'm going to be maintaining needle sterility so that nothing touches the needle. So I'm going to take the cap off. I'm going to pinch 2 inches and do it at 90 degrees. I'm just going to poke it in and then do it at a steady rate. All right, I'm going to take it out, do needle safety, and put the gauze on. Alright, I'm going to put this down. I'm going to put my needle in the sharp box. Some needles in the sharp box. I am going to document. So I did the NPH insulin at 7:30. So I'm going to do EH, and it was the abdomen. And then I gave him his regular insulin at breakfast time. And it was also in the abdomen because it was mixture. And I'm going to initial it. Sign. All right, and then I'm gonna just take everything off, and I will be right back to check on you. You can eat your breakfast now. I'm gonna go and throw out all of my stuff in the trash, and then I'm gonna go in and evaluate the patient since it's been a while. Knock, knock, knock. Hi, Mr. Lonnie. How was your breakfast? I see you ate it all. Are you feeling any dizziness, nausea, any itching at the injection site? Nope, I'm just gonna check to make sure. Alright, it looks awesome. If you need me, I'll be right outside, and the call button is right here. Have a good rest of your morning. And I'm gonna put up the curtain, do some hand hygiene, because I've been doing all these sterile aseptic interventions throughout this whole entire time. And I will see you later. Thank you.